Good evening. Today I'm going to be talking to you. This is a healthcare report about United Health Group. The organization is located in New York City. It has presence in 50 states in the US and 130 countries worldwide. Operates four platforms: Optum Insight, Optum Healthcare, Optum Prescription or Optum RX, and Optum Health. The organization employs about 385,000 personnel worldwide. They currently operate about 300 health plans. When we look at some um, barriers in the organization, for instance, in quality, there is no proper info on eligibility of the customers, which brings doubt to its quality. It also has many plans, leading to confusion on which plan best suits the consumer. Sometimes there is some services are duplicated, which limits access. Also, there's the issue of purchasing drugs from third parties. When we look at cost effectiveness, there was misreporting on inflated drug prices, inflation on medical bills, passing the cost of rebated drugs to customers so they don't have to take the liability, and directing patients to buy drugs, from other pharmacies instead of giving them what they have paid for or what they have signed up for. This leads to the customers, and this leads to the customers paying more for services instead of it being cost effective. When we also look at the barriers to access, there's no clear information about the selection on eligibility. Also, they have multiple programs that bring confusion on what is the right choice. The high cost of plans limits its access, and for some diseases that require long-term treatment, they don't have enough resources to sustain these issues. Analysis of initiatives. Various departments found an organization that help boost its initiatives. They have a finance department which is tasked with the organizational financial management. Also, recruiting, training, and managing personnel issues is done by the human resources section. They do their own advertising, and that is held taken care of by their marketing department, communications, operations control, IT department, and they also have a legal department which advises the organization on various legal activities in each department and interpret the law so they stay on the right side of the law. Looking at the organizational structure, when we talk about value-based purchasing and shared models, some of the models include, or they are highly advocated by the U.S. Department of Health and Human Services, and offer payment plans which are tied to the quality and cost of health care provided, developed in line with countries' policies. The healthcare providers are given incentives to provide quality and cost-effective services. It also operates on a shared savings and shared risk. And incentives are shared between organizations as well as losses. The components of the VBP model lies on the alternative payment model, bundled payments, global capitation reimbursement, Medicare access chip reauthorization. Some of these highlighted ones would be the bundled payments, which a fixed amount of incentive offer for full provision of the services. And then the other one would be the global capitation reimbursement, which is done on a timely basis, probably per month, and payment based on patient historical expenditure on healthcare. More on the components, you also have pay for performance, resource use, and the shared savings and losses. Shared savings and losses are two structured financial risk savings shared on the good provisions of healthcare. Risk are shared losses for not attaining the right standards. We'll talk about the implications of the VP model. It has its benefits, which will be the reduction of cost, injection of more resources, reduction on medical error, and improved quality. It also has its negative sides, which is more resources used, which may not yield results. There's disparity on distribution of benefits, that is making these deductions from some hospitals a problem. Moving on to shared risks, some of the shared models. It offers suitable agreement on how to share the cost between the payer and the health provider. But on the other hand, the implications of the shared risk is encourages innovations to use efficient methods of healthcare provision, and also helps reduce costs. Some recommendations are modernization, implementation of the VBP models on healthcare provision, adapt organizational structure which is more sensitive to customer needs, and to also address the problem of exploitation so that customers will be at ease when using the system. In conclusion, modernization of healthcare provision through efficiency, and the sector will reduce cost and improve quality. The services will be made available for a greater population. Here are my references, and thank you. Have a wonderful evening.